Yeah, this is Dr. Caudle Miller, Dr. Miller's Guide to Neurology, and today we're going to talk about Qulipta. We've been talking about migraine headaches, and Qulipta is one of the new Gepants. The Gepant's a totally new class of drugs, and Qulipta is one of the first ones that we've had. It works intracranially, blocking the CGRP receptor, so theoretically it's not as high risk of causing heart disease as some of the other migraine medications. They block the receptor CGRP attaches to, and CGRP is that small protein that's elevated in migraine, and it causes pain and vasodilatation. So these block the CGR receptors intracranially. It's once a day. It's a preventive, 60 milligrams once a day. You start with 30 and then build up. If they have any renal impairment, you use 10 milligrams. The only thing about Qulipta, which I'm not sure all of us are sophisticated enough to keep up with, is that it interacts with medications that are also, metabolized by the CYP3A4 enzyme. And so when it's co-administered with inhibitors, they increase the drug availability. When it's co-administered with inducers, it decreases. So, I don't know what to tell you other than when you are put on this medicine, you need to check your medicine list. So broadly, the antifungals, which we don't hardly ever use, but the antifungals, some of the macrolide antibiotics, even some of the more common drugs, like Cipro that we use, cyclosporin, verapamil, some of the beta blockers like carvedilol, but you just no way to keep up with all this. You're just gonna have to look it up. Some of the inducers, like the anticonvulsants, Dilantin, Tegretol, barbiturates, rifampicin, which you use for TB, St. John's wort, believe it or not. And you probably shouldn't use Qulipta with these drugs. Now, side effects are minimal. Nausea and constipation are side effects. It's interesting, weight loss up to 7% of the body weight can be seen with this because of loss of appetite. And it's sort of interesting, we talk about Topamax causing weight loss, really have not use this much, but if I have a lady or man a little bit overweight, and this can be their friend if they're on an eating program, help them lose weight. We don't want to make them sick, but if it makes them not hungry, you can lose up to 7% of your body weight. So it's going to be interesting to see how this falls out. We haven't had this drug that long. And you also have this rare allergic reaction. I don't know how realistic it is. It wasn't reported in the marketing studies, but it's just something to watch, where you get swelling in your face, swelling in your eyes, hives, rash, swelling in your hands and feet. Theoretical risk of angioedema with this allergic reaction. So I wouldn't worry too much about that. We've used it a lot with no allergic reactions, but it doesn't happen immediately. So if you're getting one of these upper respiratory type infections with swelling and your eyes swell, you need to tell your doctor because it could be a theoretical risk. There's over a risk of liver failure or cardiovascular disease or increase in hypertension. So very, very safe drugs. This is another one of those that I say it's like a birth control pill for migraine. You take it once a month. Works pretty quick, see some benefit in the first month, but give it 3 to 6 months, give it a chance. So that's Qulipta. Now, like my channel, subscribe to my channel, make some comments, and we're going to continue to talk about problems we see in the private practice of neurology. More later.